I really got involved when my students from Pace University, where I taught, started to come to me with questions that I was not equipped to answer. I kept a whole stack of Planned Parenthood cards in my drawer. They didn't know where else to go.
Planned Parenthood has been the guardian of the vision that all people will be their best selves if they have access to reproductive care and justice.
We are a high-quality healthcare organization providing sexual and reproductive health care, STI testing and treatment, HIV testing, well woman exams, cervical and breast cancer screenings.
So she came to me, she had some discoloration in her vaginal area. I was able to give her exam for her normal visit, but I also recommended her to our colposcopy clinic where she was able to get a biopsy done and found out it was actually vulvar cancer. So it worked out.
There are so many other services that are provided by Planned Parenthood, particularly in areas across the nation that are provider deserts. There are no other providers there.
So you're a woman who feels a lump in her breast. Where do you go? You want to plan your family and you need birth control. Where do you go?
Planned Parenthood believes in care no matter what, regardless of your socioeconomic status, your insurance status, your gender, sexual orientation, your immigration status. We will certainly provide you care.
Who gives birth control away, or make it possible for you to get?
Good for you. You can afford your own health care. But there are so many out there who can't, who have to decide, am I going to go for health care, or am I going to pay my rent, or am I going to feed my family?
Ruth and I are so pleased and proud of our long-term connection with Planned Parenthood. A great sense of satisfaction that we are able to be long-term donors, and we encourage others to do so.
I think not everybody realizes that we offer prenatal services.
We get to see their babies after when they come back, and you watch those babies grow up and they have more babies.
That we serve men as well, young men especially.
As a member of the LGBTQ community, I feel like I had specific needs that I needed to share with my healthcare provider, and I didn't always feel comfortable doing that with my family care provider.
We are an educational organization providing medically accurate, age-appropriate sexual and reproductive health education.
Look, sex isn't going to go away.
We are just being deluged with abstinence-only preaching, and that's really not what young people need to hear.
The goal is to make sure that young people have the tools and the resources needed to make healthy choices. Smart Wheels is our mobile services. It helps provide HIV testing for people in the community. It's free. We have a bilingual community health educator who goes into that community. TIPS is our Teen Information and Peer Services program. It provides teens with the opportunity to teach other teens in their community about sex education.
And we are also a very strong advocacy organization fighting to supply and deliver sexual and reproductive health care.
That right to privacy and to being able to make your choice with your doctor without any interference whatsoever from anyone else is a hard-won fight.
There will never be economic parity until women and minorities can decide when and if to have a child.
So what I would say to someone who isn't worried about losing their right to choose is, are you worried about racism even if you're not Black?
What if it were your family member? What if your sister, your daughter, your aunt, anyone?
A client came in and was very disappointed because the physician refused to give her a 1-year prescription for birth control pills. She would only give her a month-to-month prescription. And the reason was because the client had yet to come in to prove that she had had her mammogram done. And to me, it shows that this clinic cares about the whole health of its patients.
And right now, we are at an all-time low for unintended pregnancies in the state of New York. And some of that can be definitely attributable to the work that Planned Parenthood does.
So when we're able to be able to do that, have a patient tell an elected official, have a patient tell someone in their community how Planned Parenthood has really impacted them, it's a powerful, powerful statement.
I like working in my community. because I'm familiar with the neighborhood. I'm actually familiar with a lot of the patients. I'm able to build a rapport with them. They trust me.
They believe that women have the emotional, the physical, the mental capacity to make the choice that they want to make for their life and their family, to make their life better, period.